All right, so we will go ahead and get started with our topic today is going to be enhanced barrier precautions. First, we have just a few updates. As many of you may have heard, we can go to the next slide. The FDA did approve a simplification to our COVID-19 vaccine regimen. So this just happened on Monday, and this was from the FDA. And as we are all probably pretty familiar with the process, when the FDA approves, then the CDC has to confirm, or the ACIP rather, has to confirm the recommendations and then put them in as final CDC recommendations, which we expect that to happen by the end of this week, hopefully. So the ACIP is actually meeting today to look at that FDA changes and hopefully approve that and move forward with the recommendations. We can go to the next slide. I'm just going to do kind of a overview of the changes. Basically, they want to simplify the regimen now that we've got the bivalent vaccine. We know that it has better effectiveness against our evolving strains of COVID-19. And the big thing is that the monovalent vaccines are no longer authorized under the EUA. So in this period from basically Monday until we get CDC recommendations, we should not really be administering the monovalent, and we can't administer the bivalent. So we're just kind of in this waiting pattern that I know we've seen kind of continually as we've seen the changes in the COVID-19 vaccine recommendations. What the proposed recommendations are is that individuals who are 65 and older who have already received that single dose of bivalent will be recommended to actually get another bivalent booster at least 4 months following that initial bivalent booster. And then there's also going to be some specific recommendations as we've seen in the past for those that are immunocompromised. And then for most unvaccinated individuals, there's just going to be this recommendation to get this single dose of bivalent. And this is going to be primarily in those 5 and older. And that's given the data that we know that most folks 5 and older have either received a vaccine or have natural immunity. And we can go to the next slide. So just one additional thing to add before we look at these updates and reminders is that the organization that looks at the next recommendations for the fall recommendations for COVID-19 is going to meet in June. And what is proposed to happen is that they will potentially want us to get another booster in the fall, but it'll probably be a reformulated version. So it'll be one extension beyond that bivalent booster. So just more information to come. And National Drug Take Back this Saturday. Everybody gather up your medicines, clean out your medicine cabinets, look for a local take back site in your area. And just a reminder on that. And then also the deadline to report to the annual healthcare professional influenza vaccine summary data is May 15th. So just a heads up on that to get that information in by that deadline. We can go to the next slide. So if you attended last week, we had a guest speaker from Hawaii who had so much great information that we are going to have her back for part 2. She will return on May 3rd, and she will be covering emergency preparedness plans for a facility. So thank you, Nancy, so much, and we will look forward to seeing you again. We can go to the next slide. So I believe we have a polling question, Mary. Thank you so much. So how often are you providing COVID-19 vaccine to your residents? Okay, we're getting good results. That a lot of the folks on the call are vaccine providers and doing it upon admission. Great, thank you so much. Wait just another minute. Okay, wonderful. Thank you for this information. This really helps us guide interventions that we can have with you and interactions and support that Mountain Pacific can provide for your facilities. We can go to the next slide. So as we know, the flu activity is pretty much non-existent, not really, but going into this spring season. But I will mention that there has been, at least in our communities in Alaska, kind of a resurgent in some respiratory viruses here in the last couple of weeks. Seems like everybody I know has been sick. So we will be sunsetting this report though, and including this as we go into next fall again. But this is going to be the last week that we report out on flu on this call. Next slide, please. And then kind of still seeing that downward trend in the COVID-19 snapshot and holding pretty steady with our vaccination rate. Hopefully we'll see that go up once we get those new recommendations from the CDC finalized. Next slide, please. And then as we can see, there are still parts of the country that are still, if we look at certain communities that are having this high community transmission rate. So just to reiterate the fact that it's important to keep track of what's going on in your community, and you can always use that CDC tool where you can look at your community transmission rates. Next slide, please. Was there any questions in the chat? I don't see any. Okay, so I will go ahead and turn it on over to Erica Baldry. And thank you so much for joining us today.
Thank you. It's so nice to be here. It's nice to see some names in the chat box that I recognize. So my name is Erica Baldry, and I am the section supervisor at the Montana Department of Public Health and Human Services for the Infection Control and Prevention and Healthcare Associated Infections section. Next slide. So to start off, I just wanted to review a couple of common terms and abbreviations that I will be using throughout this webinar. I'll try my best to say them the full name each time, but I may slip and say MDRO or something like that. So just want to let everybody know. MDRO stands for multi-drug-resistant organism. And these are bacteria or fungi that are resistant to multiple antimicrobials. The other term that I may be using throughout this presentation is colonization. And colonization is when a germ is found on or in the body, but it's not necessarily causing infection. And so to make sure that everybody's chat box works, I'd love for you to answer this question. So can you name an organism that people may be colonized with, but it doesn't always cause infection? And I put a little hint here for you. What's this a picture of? Sometimes it's a cluster of grapes, as some people. Good job, Kelly, as some people. Yeah, you guys know. Okay, so MRSA. MRSA is something that individuals can be colonized with, but it doesn't necessarily cause infection. Next slide. Thanks, guys. So today's focus is going to be on enhanced barrier precautions. And in 2019, the Centers for Disease Control and Prevention, or CDC, first introduced the approach of using personal protective equipment and very specific personal protective equipment called enhanced barrier precautions. And this approach recommends the use of gown and gloves for very specific high contact resident care activities that can be associated with multi-drug resistant organism transmission. And the CDC interim guidance recommends that enhanced barrier precautions, or EBPs, are used as a strategy in our nursing homes to help interrupt the spread of novel or targeted multi-drug resistant organisms. And we're going to go into some novel and targeted MDROs later in this presentation. Next slide. A quick summary of what enhanced barrier precautions are is they expand the use of our personal protective equipment and refer to the use of gown and gloves during very specific high contact resident care activities. And this really is to help us focus on preventing the transmission of multi-drug resistant organisms in our healthcare facilities. Staff hands or clothing can become contaminated or exposed, and so we could spread MDROs through our facilities through those routes. Some examples of high contact resident care activities where we should be wearing a gown or glove include when we're dressing, bathing or showering, transferring, providing hygiene, changing linens, changing briefs or assisting with toileting, device care use such as central line, urinary catheter, feeding tube, trach or ventilator care, as well as wound care, which would be any skin opening requiring a dressing. And we're going to go into this in a little bit more detail. Next slide. So in general, once again, we want to use gown and gloves if we are providing certain type of care activities to individuals that meet the enhanced barrier precaution criteria, which we will also review. We would not need to wear gown and gloves if we are doing care activities other than those listed on that previous slide. And residents are not restricted to their rooms. So that's a big thing with enhanced barrier precautions. Unlike our other transmission-based precautions, where individuals may be restricted to their rooms, that is not the case with enhanced barrier precautions. They're also not limited from participation in group activities. And so enhanced barrier precautions are really intended to be in place for the duration of a resident's stay in that facility or until resolution of the wound or discontinuation of the indwelling medical device that placed them at higher risk. So if we had an individual who was placed on enhanced barrier precautions because they had a wound or an indwelling device, if that wound heals, or if they no longer need that indwelling medical device, we could remove those individuals from enhanced barrier precautions. Next slide. In July of last year, CDC updated their enhanced barrier precaution guidance. And so I wanted to review that today as well, as they expanded upon really focusing on just individuals that are colonized or infected with MDROs to some other scenarios. So just a reminder, there's 5 really key points for this update. The first is that MDRO transmission is common in skilled facilities. It's contributing to substantial resident morbidity and mortality and increased healthcare costs. The second key point is that enhanced barrier precautions are an infection control intervention designed to reduce transmission of resistant organisms that employs targeted gown and glove use during high contact resident care activities, right? So a specific list of care activities. The third point is that enhanced barrier precautions may be indicated for residents with wounds or indwelling devices, regardless of MDRO colonization. So previously we focused on those infected. Now we're looking at individuals that also have wounds or indwelling devices or infection or colonization with an MDRO. And this would be when contact precautions do not apply. The fourth key point is effective implementation of enhanced barrier precautions requires staff training on the proper use of personal protective equipment, the availability of the PPE, as well as hand hygiene supplies at the point of care. So if we're going to be implementing this, we want to make sure that we're training staff on how to properly apply enhanced barrier precautions, but also have access to the PPE and hand hygiene. And then finally, I think this is no surprise to anybody, but standard precautions, which are a group of infection prevention practices, continue to apply to all residents, regardless of suspected or confirmed infection or colonization status. So as with all infection control, standard precautions is a fundamental step we can take to help protect our staff, our residents, and our patients. Next slide. So why use enhanced barrier precautions? There's a couple of really core reasons why CDC is recommending the implementation of enhanced barrier precautions. The first is many nursing home residents are unknowingly colonized with an MDRO, especially residents that have risk factors such as indwelling medical devices or wounds. When I teach on MDRO to infection preventionists in Montana or even to other epidemiologists, I usually talk about infected individuals are usually that tip of the iceberg, while everything below the water surface are those individuals that we don't know are colonized. The second reason is residents who have a multi-drug-resistant organism can develop really serious infections. They can remain colonized for really long periods of time, and they may even spread MDROs to others. The third is healthcare personnel can spread MDROs, so contaminated hands and clothing. So it's not just spread through air or through droplets or things like that, like with other communicable diseases. It can be spread, through our healthcare personnel with contaminated hands or clothing. The fourth is historically, our interventions have really only focused on those that are actively infected. And once again, we know that's really not capturing what the true burden of disease is. The next is there is a need for broader approach to reduce the spread of MDROs without isolating residents for long periods of time. I think this has been a challenge, especially with COVID and having to place facilities into outbreak status for long periods of time and things like that. With enhanced barrier precautions, we didn't want to have to put people on contact precautions for months or even years. And then finally, recent studies have indicated that the use of enhanced barrier precautions can effectively reduce the spread of MDROs. Next slide. So what's the risk? Why is this important? And we kind of already touched on some of these things, but just to reiterate, residents in nursing homes, we know are at an increased risk of either becoming colonized or developing infections with MDROs. It's thought that more than 50% of nursing home residents may be colonized with an MDRO. Once again, we don't always have the best data on this because we're not always doing colonization surveys. Nursing homes have been the setting for MDRO outbreaks. I know here in Montana, we have investigated several MDRO outbreaks in our healthcare facilities, including our long-term cares. When these MDROs result in resident infections, there could be limited treatment options. Because these are multi-drug-resistant organisms, we also have a limited number of treatment options then. And then we always want to remember that implementation of contact precautions is perceived to create challenges for nursing homes trying to balance both the use of PPE and room restriction to prevent transmission with the residents' quality of life. And so enhanced barrier precautions really allows us to limit the restrictions placed on residents. Next slide. So who do EBPs apply to? Just a friendly reminder, these apply to nursing homes only. These do not apply to our acute care or long-term acute care hospitals. And so you may have a resident who at your facility is on enhanced barrier precautions, but when they're admitted to an acute care facility, they are then placed on contact precautions. So there may be differing of transmission-based precautions being utilized based on the setting type. And then this does not replace existing guidance regarding use of contact precautions for other pathogens, right? So if we have a resident infected with Clostridioides difficile or norovirus, those individuals should still be placed on contact precautions. Next slide. So when should we use enhanced barrier precautions as a skilled nursing facility? We want to use them if we have an individual who is infected or colonized with an MDRO when contact precautions do not otherwise apply. There may be certain scenarios where we do need to place an individual who is infected or colonized with an MDRO on contact precautions, but we always hope that we can transition them to enhanced barrier precautions. Or if we have an individual with wounds and or indwelling medical devices. And a wound is not a paper cut. A wound is where we're actually going to need to put a dressing on that and change that dressing and provide wound care. And then enhanced barrier precautions are not limited to outbreaks or specific MDROs. We don't wait until we have an outbreak or we don't wait until we have an organism in our facility. This is really recommended at all times. Next slide. And then once again, to reiterate, we want to use gown and gloves during very specific high contact resident care activities. We do not require private rooms if an individual is on enhanced barrier precautions. However, with other transmission-based precautions, that may be the recommendation. Once again, residents can participate in group activities, and this is intended to be used for the resident's entire length of stay, or if they have a wound or indwelling device until that wound is healed or the indwelling device is removed. Next slide. Implementing our EBPs, there's a couple of steps we should take. So we want to post signage, and I included CDC signage for EBP. We'll want to make PPE, including gowns and gloves, immediately available, right? So our staff aren't having to walk around the facility to find PPE. We want to ensure access to alcohol-based hand rub. Position the trash can inside the residence room so then staff can doff prior to exiting. This is something we've seen in a few facilities here in Montana, that the trash can's not always in the right place. But we also want to make sure we're doffing between residents as well. Incorporate periodic monitoring and assessment of adherence to determine the need for additional training and education. So we want to make sure that we're implementing these correctly, we're using them correctly, which may mean that we need to do training and audits. And then provide education to residents and visitors. So they may be confused if they see a transmission-based precaution sign or they see the enhanced barrier precaution sign as to why that resident is able to leave their room or things like that. Next slide. And then I always like to just remind facilities that preventing transmission is more than just using our PPE, and you all know this. There's other really fundamental steps to infection control that we need to implement to make sure that we're not transmitting MDROs or other communicable diseases. And there's a wonderful training from CDC that I've linked here if you're interested in learning more. Next slide. Examples of MDROs targeted by CDC include pan-resistant organisms, so organisms that are resistant to all antibiotics, carbapenemase-producing carbapenem-resistant enterobacterals, carbapenemase-producing carbapenem-resistant Pseudomonas, carbapenemase-producing carbapenem-resistant Acinetobacter or CP crab, as well as Candida auris. Next slide. And then there's some additional epidemiologically important MDROs, which may include MRSA or ESBLs or vancomycin-resistant organisms, multidrug-resistant Pseudomonas, drug-resistant strep pneumo. So my ask of you is that you please check with your local or state public health department regarding which organisms are reportable. Many of the organisms I mentioned today in Montana are on our confirmation of disease list, and so they actually need to be sent to the Montana Public Health Lab for confirmation. Next slide. And here's just a really quick visual on the difference between standard, enhanced, and contact precautions. I'm a super visual person, so I really appreciate things like this. And it talks about the precaution, who it applies to, the PPE used, the required PPE, as well as if there's any room restriction. Next slide. So now I'm just going to quickly go through some frequently asked questions to leave us some time at the end to answer any questions that you guys have. But these are some questions that I've received from our healthcare facilities here in Montana. And so the first is, which resident should be placed into enhanced barrier precautions? And we've talked about this. So if an individual is infected or colonized with an MDRO, and then once again, when contact precautions would not apply, or if they have wounds and or indwelling medical devices. Next slide. Question 2 is, which activities are included under providing hygiene? So providing hygiene refers to practices such as brushing teeth, combing hair, and shaving. Many of the high contact resident care activities listed in the guidance are commonly bundled as either part of the morning or evening care for a resident, rather than occurring as multiple isolated interactions with the resident throughout the day. And so if we were going to do isolated combing of a resident's hair and it's not otherwise bundled with other high contact resident care activities, we would not necessarily need to use gown and gloves. Next slide. Question 3, the guidance advises using EBP for care and use of indwelling medical devices. What exactly does that mean? So the safest practice would be that we wear a gown and gloves for any care or use of the indwelling medical device. There may be instances when it's acceptable to use gloves alone for some medical device. For example, if we were passing meds through a feeding tube. However, facilities are recommended to define these limited contact activities in their policies and procedures, and then educate our healthcare personnel to ensure consistent application of EBPs. And so once again, we'd want to be auditing and understanding that staff are applying these in the correct fashion. Next slide. Question 4, are gowns and gloves recommended for EBP when transferring a resident from a wheelchair to a chair in the day room or dining room? And so in general, this would not result in an individual having to wear gown and gloves. However, outside the resident's room, EBP should be followed when performing transfers or assisting during bathing in a shared or common shower room, or if we're working with residents in the therapy gym, specifically when anticipating close physical contact while assisting with transfers and mobility. So once again, understanding what we're doing, just like we would with standard precautions, and then applying enhanced barrier precautions based on that activity or what we're doing. Next slide. Question 5, when should nursing home staff use contact precautions versus enhanced barrier precautions? So there may be times when a resident has an MDRO and public health is recommending the use of contact precautions over the use of enhanced barrier precautions. So once again, please work with local public health. Contact precautions are recommended if the resident has acute diarrhea, draining wounds. That's definitely something that we've seen with some of our MDROs where we're recommending contact precautions until that wound's no longer draining. Other sites or secretions or excretions that are unable to be covered, contained, or for a limited period of time during a suspected or confirmed outbreak, right? So if we have an outbreak going on, we may have to say, you know what, we're going to use contact precautions until we can investigate this further and really get a handle on this outbreak. Next slide. May nursing homes stop using enhanced barrier precautions if we screen the infected or colonized resident and they test negative for an MDRO? And so sadly, the answer really is no. Enhanced barrier precautions are recommended for the duration of the stay in the facility. And because MDRO colonization is typically prolonged and follow-up testing to determine clearance may actually yield false negatives, we really don't recommend trying to test somebody out of MDRO status, and we would just continue to use enhanced barrier precautions. Now, this could be on a case-by-case basis, so once again, consult your local or state health department. Next slide. And then here's just a list of resources. So the first is actually a CDC training that was put together on enhanced barrier precautions, very similar to this training. The second is keeping residents safe, use of enhanced barrier precautions. And this is actually a letter that you can send to nursing home residents or families. The next is enhanced barrier precautions in nursing homes, a letter for nursing home staff. There's the FAQs, which I used some of the FAQs in today's presentation, but there's a ton out there. It's a great resource. Enhanced barrier precaution signage. I know I'm a big fan of the CDC sign, so I just wanted to make sure that was available to you. And then finally, that table, which tells you, what precautions to use, how to use them, what PPE to use, when to use them, who to use them on. So just wanted to make sure that those were all available to you. Next slide. So I think I left a couple of minutes for questions.
You did. We do have a couple questions in chat. The first one is, how would you handle a group exercise program that includes residents on EBP and the therapist might need to do hands-on or close contact with multiple members of the group?
Yeah, Maria, that is an excellent question. And so, when I'm thinking about things like this, I think, one, this is a great thing that I would probably add into my policy or procedure for therapy staff. But I think if we have, multiple residents who are on enhanced barrier precautions, just like you're saying, Maria, I think I would look at what activity am I doing? If I'm going to be having that close contact, which was one of those FAQs, right? Then we may need to be changing our PPE. We may need to be using specific types of PPE. We will want to be performing hand hygiene. So how are we going to do that? So great question. And I would love to chat with you more on that. I think it's going to be on a case-by-case scenario, but I think an excellent thing for facilities to be thinking about as we're implementing this and what our policies and procedures state.
And it looks like there was a follow-up question as well that says masks keep coming up. Do they need to change out when existing EBP room? Do they need to be changed out when exiting an EBP room if being used for source control and not part of required PPE?
Another good question, Maria. I'd love to know what facility you're from. I think we could have some great conversations. I am going to say I cannot answer that today. And the reason that I cannot answer that today is part of enhanced barrier precautions is we're using gown and gloves, and masks are not necessarily included in that. Now, if we're talking about standard precautions and I'm wearing eye protection and a mask because I'm doing something that could result in splashes or sprays, I'm probably going to get rid of that PPE before I go care for another resident or before I exit the room. So I would most likely say you would want to remove that. However, I will follow up on that question. I will ask around and I will get an answer back to the Mountain Pacific folks so we could send that out, okay?
We can add that to next week's updates for this presentation as well, Erica.
Perfect. Thank you.
Look like we have any further questions in the chat. Maria did put her location, so it looks like she is actually in Hawaii. And then I just want to ask everybody if you can go ahead and fill out the evaluation for us. We'd really appreciate it. And go ahead and keep the questions coming in, and we will get them to Erica, and then we can also get the responses back to the group that attended.